And get started. My name is Ashley Kilpatrick. I am the Cystic Fibrosis Pediatric Dietitian at LeBonheur Children's Hospital in Memphis, Tennessee.
And hey everyone, I'm Katie. I am the dietitian with the Vanderbilt University Medical Center with the adults.
Yeah, and we will be talking today about nutrition and cystic fibrosis post-Trikafta. I'll be discussing more on the pediatric side of things, and then Katie will go over more of the adult side of things. Let me share my screen real quick. All right, so a couple of our objectives today are going to be first to discuss the nutrition status goals after starting Trikafta, and then also some of the methods for optimizing nutrition status in CF, and then some of the nutrition intervention and weight management strategies we may have if it is indicated. And I will say we will definitely have time for questions at the end. So if you guys would just hold them till the end, or if you want to put them in the chat box, but we'll get to them at the end. And it looks like in the chat box, Mary is trying to get into the other break room. Rain, do you think you can assist her with that?
Yes. Mary, you should just be able to join that. If not, just hold tight and we'll get you switched. Thank you, guys. 1 second.
All right, well, we'll still go ahead and get started just for the interest of everybody's time. All right, so the first thing I'm going to talk about is really just still thinking about the importance of appropriate growth and nutrition in pediatrics. Really, one of the main goals for nutrition in general for children is to make sure that they are taking in enough calories and growing appropriately along their growth curve. And for people with CF, that can be more difficult, just as you guys already know. And that is one of the reasons why in clinic we're always talking about weight, and we are looking at the growth chart and looking at the growth curve. And thankfully, those that are eligible to start Trikafta, they may notice that weight may be easier to gain once they start it. And to put it simply, when you're on Trikafta, nutrients are more easily absorbed, so weight may be a little bit more easier to be gained. So people who take Trikafta, they may typically notice that weight gain in the first initial 2 to 4 weeks. Sometimes it does plateau after that. Some people tend to keep gaining a little bit more, and some people don't notice much of a change in weight at all. And that's the reason, since everyone's body chemistry is a little bit different, everyone's disease severity is a little bit different. We still have a pretty individualized approach, and especially in pediatrics, we monitor growth and development very closely. And since everyone's not growing at the same rate, we'll just continue to closely monitor that even after starting Trikafta. So the nutrition goals that are set by the CF Foundation do remain the same. So for infants 0 to 24 months, the goal is for weight for length to be at or above the 50th percentile. And then for 2 to 20 years old, goal is for BMI to be at or above the 50th percentile. So these recommendations are based on results showing that maintenance of these growth parameters are associated with better FEV1 measurements and better lung function. So that's really why we always are talking about appropriate nutrition status. Is in the long run, it really does help improve lung function. With that being said, there is not always going to be a one-size-fits-all approach. So since it is going to be very individualized and people are going to be gaining weight at different rates, we'll still continue to use some of our same methods to optimize nutrition status. So That's going to include increasing calorie intake with nutritional supplements or tube feeds or just more nutrient dense meals, adding extra calories here and there where we can, of course, optimizing our enzyme doses and taking our vitamins and all of our supplements. The traditional CF diet may not apply to everyone anymore. So you may not need to be adding extra butter and oils to everything, but some may still require a little assistance with those high calorie foods and those supplements. So at this time, there is not evidence to recommend decreasing enzymes after starting Trikafta. The CF Foundation is certainly, there's plenty of ongoing studies going on. If y'all were listening to Dr. Clancy's talk before this, he mentioned a couple studies that were going on that will definitely be interesting to see over the years. Are there anything that we can, cut back or take away from different people's medication regimens? So, but for now, we are just continuing to monitor. And if you do notice, though, any changes in your child's bowel movement habits or any constipation or anything like that, definitely let us know after starting Trikafta, and we can kind of work with you and figure out what we need to do. So I do definitely want to point out, just to briefly mention, is body image. And especially in pediatrics, I would never recommend necessarily putting a child on a diet per se, because this could create a negative view for that child, a negative view of food and nutrition for that child in the future. So definitely always trying to talk about weight and food in a positive way, and also just being very mindful with the language that we use. And this includes everyone on the team. So that's the doctor, that's me, that's the nurse, the respiratory therapist, physical therapist. We definitely try to always keep a positive just viewpoint on that. And if you, of course, do have any concern that your child is maybe worried about gaining too much weight, or they're worried about their body image, you can certainly talk with us about that separately, maybe, not during a clinic visit, and we can certainly address that if we need to. Of course, there are going to be instances where we may be a little concerned if maybe your child is gaining weight maybe too quickly. And so there may be things that we want to adjust in our diet while at the same time still having a good nutrient dense diet and able to still grow appropriately. So in most cases, we wouldn't recommend weight loss necessarily, but we would recommend just slowing down that growth velocity and or maybe weight maintenance for a little while, just to allow that height to catch up as they continue to grow taller. So some of these would be limiting juice and soda intake and concentrated sweets, which is, of course, your sugary beverages. Candy, gummies are a big one with kids, or any of your sweets or real sugary things. You may no longer need to add butter and oils liberally to everything. You can cut back on those a little bit. You may be able to switch to a low-fat milk or maybe a fat-free milk. And you may be able to decrease nutritional supplements or maybe decrease volume of tube feeds as well. And I would say that one is definitely pretty individualized. We would monitor that pretty closely. If we decide to decrease tube feeds, we will kind of see how that affects weight over a few months, and we may need to increase anyways, but we do continue to watch that pretty close. And then a good handout that I like, that's a good age appropriate handout for pediatrics is Go Slow Whoa. And I'll go over this in the next couple slides. And I actually have this handout in a PDF form. So if any of you guys want this, I am happy to email it to you. So you can put it in your email in the chat box, or you can direct message me and I can shoot you that email. But I like this because it's easy to understand. It's, the stoplight method. So go means green, slow is yellow, whoa is red. So your go foods are going to be your anytime foods. Those make good snacks. You can don't have to worry about eating too much of those. Your sometimes foods are going to be your, maybe a once a week food or a once a day food, depending on what it is. And then your once in a while foods, your WOW foods, they may be a once a month food or less frequently. So I'll go through a couple of these. I won't go through all this because it's a lot of text. But for example, like your vegetables, any vegetable, you can really eat as much as you want. That would be your green food. Now, if it's a fried vegetable, though, like a French fry, believe it or not, is considered a fried vegetable. That would be more of like a once in a while food if you're trying to watch your calories. And then for grains, your anytime foods would be like whole grains. And your sometimes foods for grains would be more like your white breads or your pastas. And then your once in a while grains would be more like your sweets and your donuts, cookies, things like that. And then I'll go to the next page here to touch on the drinks, because this can be a big one. That can be where a lot of hidden calories might be. Water, of course, you can drink as much as you want throughout the day. Any of your fat-free milks or your 1% milk will be good options. And then also anything that's going to be diet or sugar-free will also not be adding any calories to your day. And then your sometimes foods, your 2% milk, 100% juice, sports drinks, those are just going to have a little bit more sugar in it. And then your once in a while foods could be like your whole milk, heavy creams, sodas, sweet teas, things like that. So like I said, if you're interested in this handout, please just put your email in there and I'm happy to send that to you. And then the next thing that we definitely encourage is plenty of physical activity. So this can be a great way to kind of manage that appropriate weight gain. And this is going to be good for everyone's health. And what I usually recommend is, getting the whole family involved. See if your child wants to join a sports team and or really encourage them to play outside more. And then if you're lucky enough to have a physical therapist at your center, we have a really amazing one, and she's really great with working with our kids to come up with some age-appropriate physical activity. Sometimes that can be difficult. We're not going to be recommending weightlifting to our children, but our physical therapist can help you kind of come up with some ideas on how to stay active. And I know this was a tough one this past year, just with quarantine and trying to stay indoors and trying to be creative with coming up with things inside. But thankfully, the weather is better right now. We can get outside and move a little bit more right now. And then the last thing, definitely recommend to still continue to do extra salt and fluids whenever you are doing that extra physical activity. And then last but not least, we really still need more research. So the CF Foundation really does not have any specific guidelines or recommendations about weight gain when it comes to Trikafta. Really, most of the time, a lot of our recommendations from the foundation have been about how to gain weight, not what to do once you gain that weight, or if it's too much weight, especially in the setting of pediatrics. So I do know that they're looking at this more, and they may come out with some more specific guidelines, over the years. But for now, it's definitely pretty individualized. And so definitely work with your CF dietitian and your team. And if you have any concerns, definitely bring it up to us. I've got a few references here. Most of them are just from the CF Foundation. That's definitely where we recommend getting most of your information from, but these are some good links to the clinical care guidelines for kids and adults. There's some nutrition information, and then also just the link to general information about Trikafta. And that is all I have. So like I said, if you have any questions, you can go ahead and put them in the chat now if you want, but we'll answer all the questions at the end.
Thanks, Ashley. I'm gonna share my screen real quick. Hey, everyone, again. So just one more time to introduce myself. Like we said at the beginning, I'm Katie. I am the CF dietitian with older adolescents and adults at Vanderbilt University Medical Center. I'm super excited to be here with you all. I'm excited to answer your guys' questions and things at the end of this, as Ashley said. So to get started, we'll kind of go over the objectives of the presentation tonight. First one is just the importance of optimizing nutrition and CF, making sure that you're getting adequate nutrition that you need. Second is pancreatic enzyme replacement therapy or PERT or enzymes, and the importance of those even post Trikafta. Nutrition in CF post Trikafta, weight management and fat mass versus muscle mass, and then also how to safely lose unwanted weight that may have been gained post Trikafta. So per the CF Foundation, it is recommended that people with cystic fibrosis maintain a certain BMI because it is associated with higher lung function. For male adults, that would be a BMI above 23, and for females, it's above 22. This is why we have BMI zones at our center, which determines how often I see patients and why we stress the importance of maintaining those certain numbers. As you can see from the graph on this slide, BMI and FEV1 lung function is directly correlated. Where weight goes up, lung function goes up, and vice versa. This is why our patients maintaining a certain weight and BMI is so important to us. Next up, we have the pancreatic enzyme replacement therapy or PERT. These capsules help absorption to when you're eating, getting the nutrients that you need. They're also important for optimizing nutrition, both pre and post Trikafta. As most of us are aware, the functions of enzymes are to digest carbohydrates, proteins, fats, to help with weight gain, and to promote nutrient absorption, including preventing vitamin deficiencies. So although Trikafta has been extremely helpful in people being able to absorb better and helping with weight gain, pancreatic enzymes are still important. As Ashley mentioned, there is not research at this current time telling us to draw back on enzymes. So you want to make sure that you're still taking those with all fat-containing meals and snacks. Whether or not you notice a difference with taking the enzymes, they are working within your body to help nutrient absorption and keeping vitamin levels within normal limits and allowing your body to absorb everything it needs to function properly. It is so important to still take your enzymes after you start Trikafta for the absorption benefits that I already stated. And if you feel like you're becoming more constipated or have more signs of malabsorption, just make sure that you let your team and dietitian know so that the enzymes can be adjusted. But I do not recommend self-adjusting enzyme doses at home. So, as many of us are aware that we have heard many times tonight, Trikafta is amazing and has so many benefits. One of those benefits of helping people to absorb better, good or bad, it can lead to weight gain. Now is the time for us to all change our mindsets on the way that we look at food. You most likely no longer need to eat nonstop just to maintain a certain weight, and you no longer need to only eat high-fat foods. You can now see food as more of a great source of nutrition for your body and helping you continue to feel better and work on filling it with good sources of nutrition, such as lean proteins, less processed foods, more fruits and vegetables, as Ashley mentioned with the Go Slow Wo. I feel like we could use that for peds and adult patients. So definitely a great handout to have. And if we're wanting our bodies to perform a certain way into this healthier standard, we need to be fueling them with foods that can help us to do that. And I know this is a sensitive topic, but we want to, when we talk about weight gain and the way we look changing, body image and how we see ourselves in the mirror comes to mind. Self-perception of body image and having a healthy weight can differ clinically versus what we see in the mirror. I know from personal experience that sometimes we may be harder on ourselves than we need to be, and sometimes what we see and what we think we should look like does not match up with what is healthiest for our bodies. You may look in the mirror after starting Trikafta and notice that your body looks different. You may have a little more fat, a few more curves, but we need to realize that this little weight gain is a healthier version of your body. And it is doing what it's supposed to support a healthier lung function. Sometimes society is telling us we need to be as thin as possible, but it is okay to carry a few extra pounds if that is what your body needs to be healthy. If anyone is ever struggling with body image or not understanding the relation between healthy weight gain and lung function, please reach out to myself or Ashley or your CF teams, and we'll happily discuss this with you and kind of walk along the process with you as well. That being said, there can also be a thing as too much weight gain. By this point, I think we all understand the benefits of Trikafta, and with those, welcomed or not, can be weight gain. The importance of this presentation is to help everyone understand that the weight gain is okay and acceptable to a certain extent, and to help with understanding what is best for your bodies, whether that is a little weight loss or a little weight gain when starting Trikafta. Before Trikafta, some of you may have not been able to do a lot of physical activity because you may have gotten shortened breath. But once you started Trikafta, that all changed. So this is the time to take advantage of that and go on a walk, go on a jog, maybe start lifting weights or take up a new hobby like biking or rock climbing. Not only will physical activity help your body to become a healthier version of itself, but it will help you feel better as well. Being physically active is great for organ health, bone health, mental health, just all over health. For most people with CF, weight gain has always been a big goal and something to strive for. With my patients, I've always tried to discuss the importance of muscle mass and how building it can help with weight gain while still being fit and comfortable in our bodies. Now that weight gain is coming easier once taking Trikafta, we want to make sure that this weight gain is helping to promote healthiness in our bodies and learn how to maintain that good weight once we reach it and not continue to gain an excessive amount. Exercise and physical activity, like Ashley said, will help to keep weight stable once you reach your goals. And that means it is important to stay active. Being physically active can help with decreasing fat mass and increasing muscle mass. As you can see with the picture on this slide, we have two masses. The top yellow mass is a scaled replica of 5 pounds of fat. As you can see in the red mass below it, this is a replica of 5 pounds of muscle. This is just a visual showing how muscle mass weighs more than fat per volume, because as you can see, the actual mass of the muscle is less, even though it weighs the same. All that to say, muscle mass is a great way to gain weight in a healthy way while still reaching your health and body goals. Now that we've talked a little bit about weight and the importance of adequate nutrition and being physically active and maintaining good weight once you get there, we can have a quick discussion on how to safely lose unwanted weight if you found that you gained more than ideal when starting Trikafta. I have just listed a few very generalized tips on how to safely lose weight, but definitely ask your team, your dietitian, if you want a more specific regimen for yourself. So the first tip is being mindful of unnecessary snacking. It's really easy to just go to the pantry and grab a handful of chips or nuts or something, but that's really where a lot of calories can sneak up on us. We want to make sure that if you are eating, it's going to be like a nutritional snack and you're not just eating for old habits and just feeling like you have to. Also, sometimes our minds like to play tricks on us and we might feel hungry when our body is actually just dehydrated and craving water. So if you feel like you're hungry, but it's not a meal time or a usual snack time, maybe try drinking some water or a hydrating beverage before you go grab a snack out of the pantry. The next tip is no longer needing to go for all of the high fat, high calorie foods. Now that bodies are absorbing better, we don't need to strive to eat all of the oils, butters, cheeses, absolutely everything. You can now look for the leaner meats, whole grains, more vegetables and fruits on your plate, aiming for at least 4 servings of those a day, even though that might be hard, can be a goal. We want to fuel our bodies with foods that will help it to flourish. So limiting intake of the fried foods and the sugary foods is a great place to start. Next, as Ashley said, looking at the beverages we're drinking. A lot of people don't realize how much sugar and calories are in certain beverages. So maybe instead of drinking a large glass of sweet tea or soda, try a new flavored or sparkling water. And the next one is trying to have the protein, fat, and carbohydrate at every meal and snack. It's just really easy to grab a little Debbie or some like little sweet treat when you feel like you're hungry. But you may have realized that when you do that, you seem to be really hungry really soon after. This is typically because those snacks are filled with carbohydrates, which our bodies can burn through really quickly. So it leads to blood sugar spikes, drops, and then hunger. We want to make sure that you have a protein, fat, and carbohydrate at every meal and snack. And this will help lead to satiety and filling your body with everything it needs to keep going through the day. And then last is increasing physical activity and varying it. Our bodies are really smart and get used to the activities that we do. So it is so important to make sure that you are changing up your daily physical activities so that your body doesn't get too used to it. This will help with burning more calories and teaching your body to work more muscles and grow in fitness. Hopefully you found some of these tips helpful. Again, this is a very generalized list. So if you do want to work on safely losing weight, definitely reach out to your team or your dietitian to help you reach your own personal goals. And that was my presentation. So again, if you guys have any questions, please put them in the chat and we will get to those. And then these are my references. Also, very much Cystic Fibrosis Foundation. So that is a great place to look if you ever have questions. All right, so if anyone does have any questions, please feel free. Oh, it looks like we do have one. I'll read it out loud. Okay. Blake asks, adult patient question. I'm in the happily confused group of people who have been told my entire life to snack whenever possible and eat anything and everything I can to gain weight. Now with Trikafta, I'm at a strange place of trying to do a 180, changing 35 years of eating habits as my weight is now higher than it's ever been, and I'm having to adjust eating habits to allowing myself to lose weight. I have done a good job adjusting to lower calorie, healthier foods. I'm more finding the issue with mental habitual habits of 35 years of not even recognizing or realizing when I'm full and should stop eating because I've always crammed calories. Do you have any resources or advice on that? Honestly, Blake, I definitely think, especially like our generations, it's going to be the hardest because you do have that mental mindset from when you were really young to cram the calories, doesn't know what it is, like doesn't matter what it is. So I think the biggest thing is just being cognizant of it first.